Coming to the concept of obstetrical history taking, the first thing that you need to ask is the name of the patient. Second thing is to inquire about the age, and third thing is how much he is educated, and fourth thing is the address or where the person lives. Coming to the second, suppose if the couple had got married 3 years ago, ask whether she had undergone some fertility treatment. That is, if why you need to question as to why she has delayed for 3 years. Usually the pregnancy will be happening in 2 years or 1 year, but since she has delayed it for more than 3 years, you need to ask if she was undergoing any kind of a fertility treatment, or if there was any kind of a planning they had made, if the couple had made for the pregnancy. Coming to the second thing, that is whether the marriage was a consanguineous marriage. Consanguineous means the marriage which is between the relatives, and the third thing you need to ask is if she is the second wife, if it was her second marriage, or if it was the first marriage. Coming to the third criteria, that is about the occupation um, of the woman and the husband's occupation. Coming to the fourth criteria, that is the period of gestation. Usually we calculate the period of gestation in weeks, and the first thing you need to ask is how many weeks of pregnancy has happened. Second thing is the LMP, also called as the last menstrual period, and the third is the number of months of pregnancy, and the fourth is expected delivery date, and the fifth is use of the oral contraceptives, and sixth is ask about if she has undergone any kind of ultrasonography in the first trimester to estimate the gestational age. Coming to the fifth thing, that is the chief complaints, you need to ask for what point is she admitted. You have to use the same chronological order. First you need to ask about how many months of amenorrhea she has undergone, that is no menstruation period, and the second thing is ask if there is any kind of a discharge, and third thing, ask if there is any pain in the abdomen. Coming to the sixth criteria, that is HOPI, or also called as the history of presenting illness. In this you need to expand, or you need to ask more about the chief complaint, that is CC. Second is you need to ask about the onset, or and onset of any kind of an abnormality if she is suffering from, and the duration for which that abnormality has been present, and or the illness has been present, and if there is any kind of a pain in that, that is denoted by the nature or the character. And fourth thing you need to ask is about the aggravating and relieving factors, that is if in some position if it is aggravating, if the pain is aggravating, or if in some position if the pain is relieving, you need to ask about it. And the fifth thing you need to ask is about the site, where is the pain occurring, and the sixth thing is about the radiation, that is if the pain is radiating to other areas or not, you need to ask. And the associated factors, like for example if there is any kind of associated, if before that or just before that pain arose in the reproductive region, if there was any kind of an associated pain or any kind of a sign or a symptom that she might have noticed. And then the next thing you need to ask is about the timing and the severity of the pain, you need to ask. And if she is using any kind of a medication before, if she has consulted any doctor before, you need to ask that. Coming to the history of present pregnancy, so in the first time, if the woman is in the first trimester, you need to ask the following questions or parameters you need to confirm from the woman. The first thing is the amenorrhea. If she is having, if how many months have happened after the no menstruation period. And the second thing is the morning sickness, and the third thing is the frequency of the micturition, and then the fourth thing is about the fatigue in the woman, and then the hyper MSS, and threatened abortion, and if she is taking any kind of folic acids, if she has made the dating scan, and if she is using any kind of a drug like for TB or diabetes mellitus or any other disease, if she like any other heart disease, if she is taking any drug for that. And also you need to ask about the if she has undergone any kind of exposure to radiation, and if she has some kind of rashes or fever or any other illness, or if there is bleeding per vagina, needs to be questioned in the first trimester. Coming to the second trimester, in the second trimester you need to question about the amenorrhea, and also you need to question about the progressive development of the abdomen, or the enlargement of the abdomen, I can say. And you need to ask about the cloasma. Cloasma is brown colored patches on the face. And then you need to ask about breast changes, and pyelitis and urinary tract infections need to be asked. And then if she is consuming any kind of iron and calcium tablets needs to be asked. And then if there is any bleeding in the reproductive area, and she needs to be asked if she has taken the anomaly scan, and if there is any sonography has been done, and if there is any leak per vagina, as well as headache, if the person is having or not, needs to be questioned. Coming to the next one, that is in the third trimester, the following questions need to be asked. If and that first is about the amenorrhea, second is the enlargement of the abdomen, and then the third one is the tightening kind of feeling, and then the fourth one is the fetal movements, and if there is any kind of anemia in the woman, her reports need to be checked. And then the fifth is about the pre-eclampsia. Eclampsia means seizures in the um, uh, in the in the body. And then antepartum hemorrhage, if there is any kind of a hemorrhage, if she is undergoing, and if she is consuming the iron and I mean not iron, the calcium and folic acid tablets, if she is consuming, need to be questioned. Here you need to some other things are the frequency of micturition and leak PV, and the growth scan needs to be questioned in the third trimester. And some other additional things that need to be asked are: the first is the antenatal care visit, that is how frequently she is visiting for the antenatal care checkup, and what are the immunizations she has taken, like TT, that is tetanus toxoid injection, if she has taken or not, as well as the vaccine for hepatitis B, she has to be if she has been vaccinated or not, needs to be questioned. And also the history of the medication needs to be questioned. The fourth is the radiation exposure, and finally the previous surgery, if she has undergone or not, needs to be questioned. So these are the five additional things need to be questioned.